Bore da, boneddigion a boneddigysau, a croeso cynnes iawn i'r seminar cynllunio ar gyfer iechyd a lles gwell. Good morning everyone and a very warm welcome to this seminar, Planning for Better Health and Wellbeing. I'm Kate Eden, I'm a non-exec director with Public Health Wales and delighted to welcome you here today and to see so many people here in the room and so many people interested in how we better integrate planning and public health. Our seminar today has been organised by Public Health Network Cymru, part of Iechyd Cyhoeddus Cymru, Public Health Wales. And the network provides a range of support to practitioners and researchers across the public health sphere, and all sectors indeed who influence any aspect of public health and health improvement in Wales. We're also really fortunate today to have been joined by Welsh Government and by Active Travel Wales, who have helped us organise today, and we're very grateful to them for all of the support and input they've provided to us. Amongst the services the network provides is a seminar series on a diverse range of topics. And I'm particularly pleased to say that our topic today is one which you, our 1,000 members, have actually selected earlier in this year. And it's clear why you voted for an event on this issue. Indeed, it's clear that we face major challenges in Wales in terms of our physical health and well-being, both now and that of future generations. Planning for health isn't new, it's not a new activity, and there are areas of great practice out there where planning is leading to healthier spaces and healthier communities. But we have new legislation like the Future Generations Act, like the Planning Act, like Active Travel, and all of us, whether we're in planning professions, public health professions, the third sector, the private sector, all of us now have a much clearer obligation in our day jobs to improve health and well-being by delivering high-quality placemaking, sustainable communities, and reducing health inequalities across our communities. So we have frameworks which are changing the way that we work together, and that's fantastic to see. With the Active Travel Act, we have set Wales on a path to be an active travel nation. And the action plan and the vision that for people in Wales, walking and cycling become the preferred methods for travelling shorter distances is a fantastic ambition. But all of these things will remain only ambitions or aspirations if they're not anchored by a wider reaching set of activities that all of us need to commit to. Not just from national and local government, but from public sector across education, housing, local authorities, etc., private and third sector organisations in order to achieve the change that we want to see in Wales. So today we've got the opportunity to raise awareness and understanding of how we better integrate health and planning, to learn more about the current and evolving evidence in this area, and to identify priorities for future research and future practice. Most importantly though, it's a chance for us to network and to meet new colleagues across sectors, across Wales and beyond, and to talk, discuss and exchange ideas on how we can better integrate and achieve the transformation in planning and public health to encourage the changes in behaviour that we need to see. So please take an active part in today, ask questions, and there will be opportunities for questions throughout the morning. Play an active part in this afternoon's workshops, and take the opportunity over coffee or lunch to talk to somebody that you maybe haven't met before. We're going to hear from a range of speakers, including, I'm delighted to say, our Minister this morning. Then this afternoon we'll have a number of breakout sessions where you'll be able to discuss the morning's topics in a bit more detail. We'll also be launching this resource, Planning for Better Health and Wellbeing in Wales, which will form part of the presentation that you'll hear later this morning from Michael and Liz. But before we start, a few quick housekeeping that I have to talk about. There are no fire alarms planned, so if you hear one, there are a number of fire exits marked in green in the room. If you follow those, the meeting point is down in the Ewick car park, I'm reliably told, at the back of the building. But if you need any assistance during the day, there are network staff dotted around. Sarah, Marie and Catherine will be able to help you. We are taking pictures and doing some videography during the day. We'll be live streaming on Facebook and Twitter, and we have our digital team over there in the corner. But if anybody's got any concerns about being photographed or videoed, then please just let any one of us know. We'll also be live tweeting on the Public Health Network Cymru Twitter account, and you can see the at PH Network Cymru address there. So if you want to tweet yourself, and please do, because we'd like to make this as interactive as possible, please include the hashtag #PlanningForHealth so that we can keep track of things throughout the day and later. And you can also post on our Facebook page as well, which is Public Health Network Cymru. So without further ado, we'll start on the day's agenda. And as I said, I am delighted that she's able to join us today. So please, a very warm welcome for our Minister for Public Health and Social Services, Rebecca Evans.
Good morning and Bore da, everybody, and thank you very much for the warm introduction. I'd just like to take this opportunity to welcome you all to the conference today, and I'm absolutely delighted to be able to spend this time with you this morning. I very much welcome this event, which puts a really strong focus on the multiple ways in which health can positively be influenced by the choices that we make in planning our environment. The links between health and the physical environment where we live, learn, work and spend our spare time are complex and multi-layered. We're continuously working to increase our understanding of these important links. The nature of the relationship means that the measures we need to be taken to improve our health can't simply come from the health sector alone. Actions and policies need to reach across all of the different sectors to be effective. And that's why I'm so encouraged that there's so many people from such a wide variety of professions here with us today. In finding innovative solutions, we need planners, transport, health and environment professionals working together effectively, as well as those in education and other sectors. So I'm delighted as Minister for Public Health to now have responsibility for active travel across the Welsh Government, which exemplifies the collaborative approach we're taking under our new programme for government in delivering our wellbeing objectives. Increasing levels of physical activity in Wales is a core priority for the Welsh Government. If anything could be described as a magic bullet to help address some of the gravest health issues that we faced, not just in Wales but across the world, then physical activity would be it. Its beneficial impact on a wide range of chronic conditions such as heart disease, diabetes, obesity, some cancers and mental illness, including helping to reduce the chances of developing dementia, is extremely well evidenced. Levels of physical activity amongst the Welsh population need to increase significantly in order for the wide-ranging health and social benefits associated with being active